Lung cancer is a disease that involves the spread of a cancer cells from a tumor, which can have profound effects on the respiratory system. A tumor within the lungs can impede on the airways that exist, where the exchange of oxygen with lungs can be obstructed. This is often caused by lifelong smoking, which makes up over 80% of the cases, but can also be caused by exposure to chemicals such as asbestos, radon, and arsenic. Lung cancer is differentiated into two major different types: non-small cell lung cancer and small cell lung cancer, abbreviated to NSCLC and SCLC. NSCLC often refers to different types of lung cancer that, under the view of a microscope, appear to be larger than SCLC, but spreads less quickly than SCLC. Two examples of a more specific type of lung cancers include adenocarcinoma, which affects and impedes on the mucus-producing cells of the lungs, and small cell carcinoma, which is rapidly reproducing type that can spread to other parts of the body. Most symptoms of lung cancer often only begin to appear in the later stages of the disease, which makes it very easy for it to go undiagnosed. According to the Canadian Cancer Society, individuals at the most risk and those who should be screened for lung cancer include those from the ages of 55 to 74, who have a history of smoking tobacco, especially those who have smoked a pack of cigarettes each day for over 30 years. The most common symptoms of lung cancer include a persistent cough that may get worse and or does not stop, chest pain, coughing up blood, unexplained weight loss, hoarseness, and wheezing.
How would we treat lung cancer patients? As PCPs, our scope of practice is limited, and similarly to our treatment of other respiratory illnesses, we can only treat the symptoms associated with lung cancer and not the underlying pathology. As an initial step to treatment, administration of oxygen at a corresponding rate according to the patient's condition would be appropriate, as the patient could be in a situation ranging from minor difficulty breathing to respiratory failure. As the nature of lung cancer can vary significantly between patients, administration of salbutamol and ibuprofen bromide.
If we have a patient whose chief complaint is related to their lung cancer, upon initial assessment of the patient, they would likely be presenting with shortness of breath, pallor due to lack of oxygenation, fatigue, and chest pain. As most of these patients would be lifelong smokers, there is also a high chance that they would also be affected by COPD and other respiratory illnesses such as asthma, where upon auscultating their lungs, sounds of wheezing or crackles would be present. Some relevant findings in relation to lung cancer that could be found upon completing our AMPA assessment could include the patient undergoing chemotherapy, medication-associated chemotherapy, potentially painkillers, history of smoking, respiratory illnesses, tachypnea, altered LOC. For our OPQRST mnemonics, for assessing pain, the patient could describe pain from a range of either being a dull ache to sharp pain that is worsened upon breathing or coughing. This pain could also feel like tightness of chest, in which the pain can radiate from anywhere on the chest anteriorly or posteriorly.
What makes up a vast majority of cases of lung cancer? A. Radon arsenic. B. Asbestos. C. Both A and B. Or D. Smoking. The answer is D. Smoking. What kind of pain are these patients likely experiencing? A. Left shoulder pain. B. Heartburn. C. Tightness of chest. D. All of the above. C. Tightness of chest.